Dr. Prasanna Shah, we are so glad at DocPlus that you took time out from your busy schedule to actually just have us over here and gracing our cover. We are extremely grateful. To
Thank
begin
you.
with, I want to tell all of us that we are going to be having a new insight on gastroenterology thanks to you. So please tell us how is India placed right now?
In terms of gastroenterology, yes, we are placed very well. We are at par with the world in terms of technology because there's a lot of new technology which has come into India, and we have trained people, we are training people, ourselves have been trained in that technology. And what I'm talking is more interventional gastroenterology, that is endoscopies, colonoscopies, uh, other procedures called ERCPs, endoscopic ultrasonography, and now we are also gone into what we call as a third space endoscopy. So these are the new exciting times for us in the field of gastroenterology. Apart from this, what I've diversified into is management of obesity, and that too by endoscopy and no surgery.
Oh.
So we're trying to go into a plane where it'll be incision-less procedures, so less time of hospital stay, faster recovery, lesser complications, lesser mortality, and which is going to be a beneficial thing for patients and doctors.
I hear you, and the first thing that comes to my mind is that this is the need of the hour. So, can you get us a little more details about these procedures
Yeah,
you just mentioned?
unfortunately, what has happened is over the years in India, medicine has progressed. But the downside of medicine is that we've had those many complications or those many diseases which have also come up. And that's primarily because prevention. As they say, prevention is better than cure. There's not been much of preventive measures. So look at obesity, look at blood pressure, look at diabetes, look at cholesterol, like hyperlipidemias. They're all on the rise. We are the capital in diabetes. We are the capital now slowly coming to obesity because of a huge population. So therefore, what we need is first is prevention and then getting on to, treating this. So that is very important.
True. You just mentioned, I mean, obesity itself has become one of our leading problems, which was never the case. I mean, we have heard about it in America, we have heard about it in other countries. For us, we still think that a lot of us do menial jobs, do the stuff like that. But sedentary work has now become a part of our lifestyle too. That does leading to a lot of issues and stuff like that. Obesity being one of the, you've had many breakthroughs in this field of expertise. Could you share some of these, the ones that you have introduced your patients to?
Yeah. So what we've been doing is I've been doing for the last now 4.5, 5 years is we introduce this silicone balloon in the stomach and it's all through the mouth. So there's no incision at all. So it's this silicone balloon which is placed through the mouth and it goes into the stomach, and we inflate it in the stomach by instilling saline with a little bit of methylene blue, and we fill around 500 to 600 cc of saline in this balloon. You can go up to from 400 to 700, but my experience is 550 is good enough for our patients and our body habitus and our population.
Right.
And this balloon is put in the stomach, is placed in the stomach for 6 months. So it basically acts like a space occupying lesion where the capacity of the stomach comes down, the quantity of food you eat comes down, and there's always a sensation of fullness, like satiety. And therefore, the patients don't eat. Apart from that, what does the balloon do? It induces what we call as a gastroparesis. Now, what is gastroparesis? Gastroparesis means slowing of the stomach movement.
Okay.
Because every time we eat, the food is pushed down because of this peristaltic movement of the stomach. Now, the balloon, it induces a slowing of the stomach, and therefore there's no much empty, and therefore you're constantly full. And that's how one generally tends to lose weight. And my patients over 6 months period have lost around 15 to 18 kilos in 6 months. After 6 months, what do? They come back to us. We puncture the balloon. They're all specialized needles and forceps and all those which we have while doing endoscopy. And we pull out the balloon and the patients go home the same day. Similarly, for the insertion also, they don't need to be admitted. So they're kept in the hospital for 2 hours. It's what we call as an OPD procedure, outpatient department procedure, and they go home. Yes, we give them a specialized diet, we give them a specialized exercise regime, certain do's and don'ts which they have to do, and yeah, they're on their way to losing weight.
I mean, I can almost hear your patients saying that, oh, this is like the blessing that you got to India and of course the city. But what was the one thing that, I mean, I understand it runs in the family, but what was the one thing that kind of pulled you towards gastroenterology to begin with?
Uh, I've been blessed. I've been blessed to have a father like Dr. Sharat Shah. He's one of the senior most gastroenterologists in the country now. And I've been seeing him as a child. I've been seeing him doing endoscopy. So, as you know, boys like toys. So, same thing like a small child, a boy, I saw him doing, endoscopic stuff and ERCPs and all, which fascinated me and say, okay, I need to do this. Now, to get there, I have to go through the whole rigmarole of MBBS, MD, or DM, and then you start doing this. So, my first and foremost inspiration was my dad. I saw him work and work so hard and doing all the endoscopic work. So, obviously, that kind of pulled me towards this field. And I think surprisingly, when I was giving my board exams in the 12th at that time, there were a couple of TV serials which came on the TV on medicine and the hard work they do and they staying up at night, saving patients, the joy on their faces. So that also kind of gave me a little bit of an inspiration that, okay, when the whole of the world is sleeping, I'm up saving somebody's life. I think that's a different high for a doctor. And believe you me, when a patient gets saved by a doctor, there's immense gratitude for the and satisfaction for the doctor. There's no other motive. He just has a good feeling saying that yes, I saved a life. Now that's an immense power to have in this world. It surpasses, I think, every other power. So I think that was the biggest motivation that okay, my dad who's achieved so much, and I need to also go there and help people and do something where I can give back to society and basically prevent all these problems.
True. Uh, at the same time, a lot must have changed from his time to yours. Do you ever sit down and exchange notes and talk about things like that, or how is it? What is the
Yeah.
work relationship like?
Yeah. So basically, medicine has changed in the last 40 years. It's transformed leaps and bounds. There's new medicines, there's new medical therapies, there are new protocols. What we used to treat earlier, now that has completely changed. They're all different protocols now. So for me to have a father like him, it's his experience. The biggest enrichment one can get is his vast 40 years of experience, because a simple thing like fever can be presented into 100 different types and 100 different ways. Because medicine, as I tell everybody, 2 plus 2 is not 4 in medicine. It can be 1, it can be 3, it can be 10, but it's never 4.
Yeah.
And therefore, experience is very important. And I get his experience when we discuss a case and say that
Right.
okay, I had this patient this, and he says okay, you should think about ulcerative colitis, you should think about some infection. It's not just a simple irritable bowel syndrome. Okay, so that kind of gives me more insight, and I think that's very important. I think experience is more important than anything else. And yes, how it has changed, medicine has now come onto everybody's phones, on tablets and everything. Now that tablet has changed into a tablet where people are getting. So we have a lot of Google doctors, unfortunately, which is risky, because medicine is not easy. Medicine, let me tell you, is not easy at all. That's what, otherwise everybody would have been a doctor. We have spent 5.5 years, 3 years and 3 years. So it's been 11.5 to 12 years of sheer struggle, and reading between the lines is very important. Medicine is not just lines. You have to read between the lines because it conveys a lot more. You need that sixth sense. So therefore I say that medicine is not easy. A lot has changed. A lot is there now available on the net, which was not available first. We used to run to the library, subscribe for a journal, look it up. But now, at the push of a button, everything is there. The latest articles, the trials, the medicines, the side effects, latest procedures, doctors who share their experiences, how they've handled this case. So we read those, and and that's how I think bonding between doctors also has improved, because we share knowledge. Just one aim is to get the patient better.
True. There's a lot of myths regarding, people want to first try home remedies, they want to do this, plus they want to go to Google and assume that they have the worst kind of diseases before they have even approached the doctor. This might be a simple hurdle, but it can get really, really complicated sometimes. Having to deal with something like this, having had the experience of having a father, of course, you've already had a bit of experience before you even start there. But then, what happens with the protocol that you just mentioned? There is so much of legalities that now are into place. Then there are so many other kinds of documentation that we need. Okay, so how was that journey for you?
So earlier, the as you rightfully said, documentation is very important now. So a lot of documentation has increased, which was not there earlier. We have to document everything. If the patient also says that no, I don't want to get admitted to the hospital today, but I'll come tomorrow, we write it down because it's no more a word of mouth of a doctor.
Yeah.
Because they just turn back and say, you told us go home. So we don't want that now. Everything is on paper.
Right.
The feeling which people get, or the feeling which people had earlier, that doctor is God, it's not gone. It is still there. It's in a very small fraction of people. But now people view doctors in a very different way. And so therefore, our viewpoint to safeguard us, we have increased documentations in our own private practice, in the hospitals also.
True.
So that is a big change which has come, documentation. That is very important. And I should tell all the doctors, yes, you need to document, including time.
Oh.
That's very important. And most important, I think, is just communication with patients. You spend that extra 2 minutes with them to tell them this is the things and tell them everything. That look, he's good, he's bad, or he's not improving, we're doing this, there are other options, these are the options you have, and you should, I think when you have a proper communication, that's where everything is smooth. When there is no communication, that's where the problems arise. Because then there are other people who are communicating with those relatives who are not doctors and not expert opinion, and that's where the mess comes. So I think communication is important and documentation is important. So this is a big shift. Earlier, probably before the 1980s, what doctor said was a gospel truth, and that's it. Means he's gone, he's gone. But now, no. You need to document it, you need to communicate, and you need to tell them. And that's it. And I think faith in doctors will come back. I think it's never gone, though it's a lot in the media, unfortunately. But I can just say that the faith in doctors has not diminished so much. People still have faith. It's just that if we communicate better, the faith is going to get more cemented, nothing else.
You've had a lot when it comes to digestive disorders. I mean, there are, given the lifestyles that people are leading, there are whole different things that are coming up every day, literally. I'm sure that you must have also faced a lot of new kinds of diseases that are coming forth more than they were earlier, in your years of practice too. Then there are also, what are the disorders that you see more commonly?
So in private practice, what we commonly see is acidity, is reflux, constipation, loose motions, pain abdomen, vomiting. We occasionally see jaundice. Because I'm an interventional gastroenterologist, we do endoscopies. So we see vomiting of blood, passing of black stools. So these are all the things one commonly sees. Now acidity is basically, it's a sensation of burning. People should understand that. People think I've got a gastric problem, means they say burping, eruptions and all that. Okay, but they misconstrue that as acidity. Acidity means burning. There should be a burning sensation in the stomach or in the chest. If it's in the chest, it's called reflux. If it's burning in the stomach, you have to think of an ulcer. So the commonest which we are seeing now is the Helicobacter pylori infection. It's a bacterial infection which causes gastritis, gastric ulcers, duodenal ulcers, and in the long run can cause cancer of the stomach. And so therefore it is very important that we have to eradicate H. pylori. It comes by contaminated food and water. Almost 65 to 70% of Bombay is contaminated with H. pylori. People are infected with H. pylori and they're completely asymptomatic. They can just have one bout of acidity and no it. So therefore, eradication is very important because you can prevent a cancer.
True.
So that is important. So you have acidity, you have burning. You have other things like an irritable bowel syndrome. The IBS is a huge thing where people come with constipation, loose motions, pain, and a combination of all these three with anxiety disorders. And now, hectic lifestyle, irregular eating, fast food, fatty meals, these all basically stress the GI system, and that's why all these symptoms are caused. What we also see in my this thing is we see a lot of pancreatitis. Pancreatitis is basically the swelling of the pancreatic gland, which is right in the middle of the abdomen. So that is what we call as pancreatitis. Now, it's acute and it is chronic. The acute can be life-threatening, and so therefore they require immediate medical therapy. And chronic are the indolent ones which keep coming on and off. So those are the ones which come into the hospital. That's the acute and chronic pancreatitis. You have viral hepatitis, you have jaundice, you have liver-related complications which come. Then you can have cancers. We have cancers of the food pipe, stomach, of the colon, of the gallbladder, of the pancreas, of the liver. They all are coming.
And this is a rising epidemic.
And it's a rising epidemic. Correct. It's all because of lifestyle, all because of smoking, alcohol. So these all have some factors. People sometimes say, Doc, I smoked and drank the whole life. Nothing happened to me. Look, every person's genetics is different. So, some people can have alcohol for just 4 or 5 years or 7 years, and they'll end up with, alcohol-related complications. Some people can have it for years together and nothing happens. And so therefore, as again I've said at the start, prevention is very important. We need to concentrate now on preventive gastroenterology and prevention. And that's where everything will come down, including your obesity and obesity-related complications. So this is the common things one sees in practice.
Since you mentioned alcohol, and you've also edited a book about cirrhosis of liver and its, and its progression. So could we hear a bit about the book too?
The book basically talks about preventive measures in cirrhosis of liver and its progression. So what are the things one has to prevent? So we mainly talked about vaccinations, avoidance of alcohol, and obesity again. See, obesity comes everywhere. Obesity, the fat goes into the liver. It causes what we call as a fatty liver, which there are grades of fatty liver. And the last stage is NASH, that's non-alcoholic steatohepatitis. That is liver which is so inflamed it causes destruction and cirrhosis of liver. Hepatitis B and C causes cirrhosis of liver. So we have talked about all these things which can prevent, progression of cirrhosis of liver and prevention of cirrhosis of liver. Alcohol is bad because it causes a lot of systemic problems also, not just the liver.
Right.
So therefore, abstinence and avoidance of alcohol is the best. Wine, therapeutic wine is recommended, but nobody knows what the therapeutic value is. Like common man, they'll say, okay, but actually not more than 10 grams of alcohol one should have. Daily of wine is okay for the heart, for the coronaries, so that's good. But people don't really stick to that. So we just say better avoid.
Just talking about a lot of, I don't know whether you can call it only the urban disorders or reflux disorders generally, has been, the urban lifestyle is becoming quite rampant. And you have, had a lot of cases and stuff that you could share with us. Could you just light up a little bit for us?
Yeah, reflux disease is on the rise. There are multiple reasons. Now, what is reflux? Reflux is the refluxate, or is the abnormal contents of the stomach coming into the mouth. That's called reflux. And that can be acid, that can be food. There are many reasons for that. Commonest ones we get to see is if you have a hiatus, that is part of the stomach coming into the chest, then you can have a reflux. If there's a valve between the esophagus and the stomach, if that valve becomes weak for whatever reason, again you can have a reflux. There is a physiological reflux in pregnancy. Pregnant women get reflux, but that's a happy reflux. I call it a happy reflux. Okay? So the other reasons is again obesity, there's more reflux. Alcohol, smoking, reflux. Certain medicines for blood pressure, certain medicines for asthma causes reflux. Then you have other causes of reflux. There can be bile which can come up. That's again a reflux. So you treat this by giving them antacids and other medicines and lifestyle changes. We do endoscopy for reflux also, and the endoscopy we try and find out how much damage is done to the reflux. So there are two types. You have erosive reflux disorder or non-erosive reflux disorder called GERD or NERD. So there are these two types. And GERD erosive, then you have to find out how much of erosions or ulcers in the food pipe because of the acid being refluxed on top. So we do what we call as a LA classification. So that's class A, B, C, and D. The downside of chronic reflux and not being treated of reflux can produce what we call as Barrett's esophagus. Now, Barrett's esophagus is a cancer of the esophagus if not treated. Okay, it's adenocarcinoma. So therefore, it's very important that patients who are chronically refluxing, need help to prevent again cancer of the esophagus, the Barrett's esophagus. So how do you prevent refluxes? You have to take small frequent meals. Do not lie down immediately after food. Avoid large fatty meals. Avoid fizzy drinks like your colas and all those things which can cause reflux. Avoid things which are precipitants for reflux like mint, onion, garlic. So they all can cause reflux. So these are the coffee, very common. Black coffee causes reflux. So this is all lifestyle. If you see, you need to change your lifestyle first. Everything is not just medicine. Medicine will be 30 to 40%, but 60% has to be a lifestyle from your end. So if you do that and you take the medicines regularly, you'll be 100% cured. But if you don't do any of them properly, you're bound to have a bit of it remaining with you, and that's how you have to keep coming to us. So the first thing I stress to all the patients is lifestyle. You need to change your lifestyle, and that's where this can happen. And reflux is common. It can be seen in children, it can be seen in adolescents, it can be seen in adults, young adults, it can be seen in old age. And so it's across the board, reflux. And it's definitely on the rise because of fast food, because of all our lifestyle changes, alcohol, which is so commonly consumed, both now male and female, smoking both male and female. So obviously, things are getting worse, back to worse. We have other newer therapies which are available now. We have what we call as an anti-reflux mucosectomy, called as the arms procedure, and the stretta. Okay. It's basically burning the mucosa of the lining of the mucosa of the esophagus, and that kind of closes the valve because of the burn becomes hypertrophied, it becomes edematous, and it closes the valve, and therefore it prevents the acid coming out. That's called stretta technique. Arms is basically we resect part of the mucosa from the stomach side, and by fibrosis the valve it shuts. This is a procedure which is newly introduced into the world by Professor Inouye. I had the good fortune of meeting him in one of the conferences and interacting with him. So that's the new 2 procedures for reflux, which we have started doing. I've personally done a few cases of arms. Stretta we still need to start in our hospital, at the Bridge Candy Hospital. So we're getting there. We're just getting everything set up. Yeah.
You've actually, right from colonoscopy to ERCP, you've introduced a lot of new techniques in India too.
Yeah.
How was
So we started off with plain endoscopy. Endoscopy is visualization of the esophagus, stomach, and duodenum. It's a small tube goes through the mouth and comes. Now that can be done diagnostic or it can be therapeutic. Therapeutic means we can stop bleeding, we can remove polyps, we can remove foreign bodies. I've removed dentures, I've removed toothbrush, I've removed nails, I've removed marbles from the stomach, I've removed all sorts of things. That's endoscopy. Colonoscopy is visualization of the colon. Now it is important because colonic polyps can develop into cancer. And we don't unfortunately have a screening program in India. Like the US, after 50, everybody has to get their colons checked for cancer. There are multiple reasons for that. The reason is because all our foods is basically green, leafy, fibrous food. Our foods are rich in antioxidants. So I guess that's the reason why the incidence of polyps amongst Indians is much less as compared to the West, where they don't have much of this. There's a lot of red meat consumption. We don't have that here. But because of lifestyle changes, fast foods, we're seeing increasing incidence of polyps and cancers of the colon. And so therefore colonoscopy is important for screening. You can do diagnostic colonoscopies and you can do therapeutic. Again, in the colon we can remove polyps, we can stop the bleeding. If there are foreign bodies, we remove foreign bodies from the colon also. So those are the things. ERCP is basically visualization of the bile duct. It's where all the bile from the liver and the gallbladder comes down into the duodenum and it goes and mixes with the food, and that's how digestion takes place. Now there are gallstones, stones which come into the bile duct. It causes jaundice. So we have these scopes which can go pull out the stones and the jaundice is relieved. It can be cancer of the bile duct, cancer of the papilla, cancer of the gallbladder, cancer in the liver itself. And so you go in there and you do the treatment. In that also there are many techniques which are now available, new stuff which has come in. The other procedure which I was talking about is endoscopic ultrasonography. It's basically the endoscope which has the tip has a sonography machine. and that's how you can get to see the inside. That's basically endoscopic ultrasonography. Now the new thing which has come in, the new baby of probably endoscopy, we can say, is third space endoscopy. Now what is this third space? There's a gap between the skin and the intra-abdominal vessel. You need to just do that, okay? So what we started doing is now third space endoscopy. Third space is the space in between the skin and the inside skin, in layman words. All right. So we are working between two layers of the skin, and that's the third space we have kind of. And what does it do? We do endoscopic mucosal resections called EMR. We do endoscopic submucosal dissection, that's EST, and we do what we call as POEM, that is POEM, that is per oral endoscopic myotomy. That is very exclusively for a condition called achalasia cardia, where we cut the muscle fibers, and patients who come with difficulty in swallowing, or patients who have food which gets stuck, that can now immediately go down the food pipe and it doesn't get stuck in the esophagus. EMR ESD is again superficial lesions, cancerous lesions, now can be shaved off, you don't need to get surgery. So these are the new things. Polyps which are a little deep, again you can resect them by using endoscopic mucosal resection, EMR. It's another technique. There are specialized instruments which are required for all these which I've just mentioned, and so therefore not all the centers do it, but few centers do it, primarily because it becomes a little expensive, because there are new instruments, equipment is new, so patients have to pay for all this, and so therefore it's slowly coming in, and hopefully things should get better with the numbers.
But since it is far less intrusive, I think these are the way forward when it comes to.
Absolutely right. Absolutely right.
At the same time, I'm hearing all these new techniques, and I'm thinking about this man who is working for so long, so hard, the amount of stress that you might be dealing with. How do you deal with this? Because I think every doctor should know about it. Like when you lead a life like that, when you are saving lives, it is as you said, it's a boon that you have, that you've been gifted. At the same time, amount of stress that you deal with every day it's inhuman. How do you deal with it? What are your strengths? How do you cope?
I think there's a famous saying: if you love your work, you don't work at all. So for me, endoscopy, I love it. So the stress of this doesn't really come. When you're doing your job, you're so focused. Yes, after that, there's a sigh. Religion, I think that's really important. Keeps you grounded. So I think you just say your prayers, and that should be good enough for you. I listen to music. I like music, and it could be anything. It could be Hindi, it could be English, old, new. I have 3 wonderful daughters who keep me, busy, make me laugh. I think that's the best stress buster I have. I have lovely parents. I have a wonderful family, my sisters, my wife. So I guess I'm just blessed. So I think that's the reason, and that's how I just stress buster, as they say. Movies is another thing. I like to watch movies. I think that's good. I do play some sports. I like to play cricket, as every Indian would like to cricket. So I have played cricket and badminton. I play badminton. So I'm both indoors and outdoors. So that's how I do it. And I think just listening to music and walking. I do walk regularly. I think that just kind of stresses, de-stresses me. And I think lastly, laughter is the best medicine. So you laugh, and laugh. I think that's the best response. And I think that's how I actually, get out of situations, serious situations. Right? Yes, it is serious, but then I would take a little funny side of that and laugh a bit, so that I de-stress my own self. Because sometimes treating celebrities is not easy, because there's a lot of pressure, there's a lot of stress. Patients who can afford treatment abroad come to you saying that, no doc, you're good. So that gives you an added thing. So you know that you cannot, err on your judgment one bit. So I guess, that's about how I deal with my stress. I think people have different ways. This is my way of dealing with stress.
You just mentioned your celebrity clientele, and when it comes to a doctor, I understand the confidentiality part of it. But the only thing is that when it comes to dealing with celebrities, there are a lot more that goes into it. For somebody who has been so experienced, What are the do's and the don'ts according to you?
So when I know, see, we never differentiate between a patient. They're all the same.
Right.
Technically, they're all the same. But yes, because there's added pressure when a very well-known personality comes in. A celebrity is your words, but we say, okay, well-known personality. So when a well-known personality comes, we'll again do a rerun in my own mind. Okay, this is the procedure. Now, what are the things we require? If there is a complication, what are the things which are my backup? They're there. I get all of that set, and then we do these procedures. Technically, it comes to practically all the patients we do because we don't want to have any procedure-related side effects or complications, as they say. We don't want it for any patient, whether it's a poor man not affording at all and a free class patient, where I do it at Giant Congress Clinic at Daiwadi. They have a giant clinic there. I do my work there also. It's giving back to society. I'll take the same care as what I'm doing it with a very well-known personality. So it's basically a rerun of your thoughts in your own mind, making sure everything is there, everything is proper, and that's how we do the procedures. And you treat the patient as a regular patient. If you treat him as someone, oh my God, somebody really big, then obviously your own judgment is going to get a little fuzzy. So just treat them as, okay, they're the routine patients and that's it. And then that's how you have to deal with these patients.
You did mention a bit of Google when we were talking earlier, and a lot of alternative therapies are kind of coming up. People are reading up about it, but are they some that you really endorse, or you think that it's all just a quack method?
No, I think every medicine and every science has its own place. My science is my science. It's preached, practiced. It has gone through all the the trials. So I know what my science is. I really don't know about Ayurveda and homeopathy. Though they are good, people have had relief. So for me, if that works, works for you.
Right.
Yoga, I tell all my patients that yes, you should do yoga. That's important. Pranayama and Shavasana, because that just calms your mind. And it's proven because you have what we call as a brain-gut axis.
Right.
Whatever signals the brain transmits, it goes to the gut, it can react in different ways. So you calm your mind, the signals which are passing through, that also get calm. So I think yoga has a place in basically, calming yourself, especially for the patient with irritable bowel syndrome. The other alternative therapies, Unani, I really don't have any experience. I've not even read about it. The other homemade remedies, yes, why not? Turmeric powders is good, like haldi is very good, it's an antioxidant. Garlic is good. So these are a lot of homemade remedies also, which probably my granny used to give me and all. They worked, for whatever reason they worked. There were no medicines at that time. So, yes, they have their place. But being an absolute, medicine guy, I would say my allopathy is right up there, yeah.
I wouldn't blame you for that at all. But what are the therapeutic advances that have happened in gastro as of now?
Yeah. So the therapeutic advances, what I spoke about is interventional gastroenterology.
Right.
There are a lot of other, advances which have come into gastroenterology also. Like people are now doing liver transplants.
Right.
It's very commonly done in the city of Mumbai. We must have done more than 500 by now, and with a good success rate. Patients are alive and they're doing very well. People are now starting to do pancreatic transplants. This is what I just heard yesterday that they are planning. Surgeons have gone abroad for training, so they're doing. Soon we'll start having pancreatic transplants. The other advancement is again medical therapy, where hepatitis B and C, which was a killer, is now much under our control. There are newer drugs which have come into that. Inflammatory bowel disease. There are newer drugs which can completely cure ulcerative colitis and Crohn's disease. You don't need a surgery for that. So all these advancements have come in, and there are exciting times ahead for medicine. There's lots more which is coming in, and probably a much more cure rate. So I think that's good.
One thing that a lot of doctors insist on is to keep on reinventing themselves, going ahead with time, keeping up with the new stuff that are coming. What is your advice to the young doctors, perhaps, who are wanting to, get into gastro?
Yeah. So after I finished my training, I went to Mayo Clinic, Rochester, Minnesota, and I was there for 3 months. I did 1 month of observership at the Royal Free Hospital at Hampstead in UK. And I came back, and before that I went to St. Peter's University Hospital, again 3 months in New Brunswick, New Jersey, where I worked with Dr. Pichumani, a very big man in pancreas. At the Mayo Clinic, I was observing with Dr. Todd Barrett, another big guy in therapeutic endoscopy. And I also trained at St. Peter's University Hospital, New Brunswick, New Jersey. I think it's important for every student who passes out should have a short stint abroad, because their whole working, functionality, the passion and the compassion they show towards their patients and the care is something unbelievable. So I think my advice to everybody is that who passes out, if they get an opportunity, should go abroad and train, not for the knowledge. Knowledge we've all gained here. Experience we've all gained here. What we don't have is etiquettes. Are the proper etiquettes. How to present yourself towards a patient. How to talk, how to conduct yourself in front of a patient is very important. Nobody wants to be treated badly, however bad or however good. Nobody wants to be treated badly. And that's where all doctors, I think now, next gen which is coming, should do this.
Right.
And our whole level of medicine, our whole level of clinical care is going to go up by this. So that's my advice to all the young guys and girls who are coming, that they should have some stint abroad just to get a good exposure of things abroad. Yeah.
Especially, I mean, earlier you had mentioned this thing about how doctors initially were treated as demigods, and now you said that it's not exactly gone, but it's not right there. When people are not really, at the same time, patients coming forward and telling things like, "Oh, we read up, this happened," and to keep your patients that time and your patients. So it is a tricky thing. And when you spoke about etiquettes and things like that you keep on need to nurturing yourself with, it's definitely very important. But when it comes to for you, like individually, the stream plus your experiences this far, what has been your individual high?
As I said, that if a patient is saved, that's the ultimate high one can get. I think it's the strongest feeling one has. So, or if I have a 75-year-old man who I've treated for a bleeding problem, and till date, on that specific date, he will call me and thank me every year and says that I am now 4 years old, I'm now 5 years old because you saved me. I have elderly patients coming and touching my feet, which is so not so for me, but it brings me so much, and that's the thing.
So well.
We doctors have the power to heal. We have to use it right. I think that's very important, and that's the high. When people talk nice about you, you feel nice, you feel grateful, you're humbled by all the good words they give you. I guess that's the thing. He could be the richest man in the world, but I have seen, when I was doing my post-graduation, there was this very big man who had got admitted to the hospital. They were like billionaires. But this man, he bent down and touched the doctor's feet, saying that, "Please save my son." So, that's the only field where so much of power is given in your hands that it is just, it's really amazing. So I think this is one thing which I feel in my profession. And you see a patient smile at the end of it, or you see them walk back home, and that's great. Or then you have mothers who come and give you, their ashirwad, and they bless your children, and they bless your parents. I think that all really works. So I think medicine is tough, it's hard, you need a lot of passion for it, but it's very rewarding. It can be rewarding. It's more rewarding in terms of prayers given to you and the gratitude people give you rather than just money. So important, I tell everybody in my life, everybody, whoever, including my patients, friends, everybody, I say, health is wealth. If you have health, you have everything. So I think important thing you have to know is just keep yourself good and keep yourself healthy.
Thank you so much, Doctor, for speaking
Thank
to
you.
us.
Thank you so much.